Hello, welcome. I'm Peggy, and I do hope you'll find time to stay with us for this show because this program can change lives and it can add good health and years. And I'm really pleased to have back again, you were here a long time ago, Dr. Desmond Smith. And he walked in the door with his son today, Alex Smith. And we're going to talk about basic, simple changes that you and I can make in the way we live, the choices we make, what we eat, that can add health and years to our lives. And I thank you, sir, for coming, both of you. Now, before we talk about all these things, let me just tell people, this list goes on and on, but he is a professional member of the American College of Physicians, the American Heart Association, the International Society of Hypertension in Blacks, American Cancer Society, American Medical Association, American Society of Hypertension, and he has a degree from Mount Sinai School of Medicine, and he did internships at Harvard University and the University of Texas, and he had residency in Columbia University College of Physicians and Surgeons, and he is you're certified in geriatric care, internal medicine. It goes on and on and on. So, but I wanted people to know that you certainly are qualified to talk about these things. And it is true that we can, if we take responsibility for our own health and that of our families, we can make simple changes.
Mm-hmm. Oh, absolutely, Ms. Dandy. I think that the patients or the people that actually take advantage of involving themselves in their care from a physical standpoint are the ones that will do the best. When we talk about wellness today, we're talking about not only going to the doctor and getting a pill.
Yeah.
I think that's getting dated. I think that's getting old. I think wellness includes first an emotional status. It also includes your biochemical profile and also your physical capabilities and profile. So to accept the fact that you can only be well if you go to the doctor to get a pill for your blood pressure, a pill for your diabetes, a pill to sleep, a pill to wake up, then you're not really a well person. You have to actively involve yourself in healthcare, in your own healthcare, to become well. And so we're about trying to give people that information. The other issue at hand, specifically in South Carolina, is that the number one cause of death is cardiovascular mortality, whether it's a heart attack or stroke. It's also number one in the United States, but right now, South Carolina leads in the state of this union in cardiovascular death per population. And that's sad. We need to do more about longevity in South Carolina. So Alex and I, we have a practice. Our practice focuses not just on providing medications, but also on doing things to help patients to get well, particularly our diabetic populations. A number of our diabetic patients, through exercise and food therapy, they have been able to come off of their medications and do without them for long periods of time. And of course, that takes losing weight and it takes physical activity, but that has to be done in a safe way.
Yeah, you don't just say, I'm not going to take this anymore.
No, you just can't. No, we can't tell. I'm not suggesting that they stop taking their medication abruptly and just start to exercise. It has to be planned out and has to be done in an incremental manner. But we've seen tremendous benefits gained by patients that are willing to go through this process.
All right, now, Alex, when I introduced your father, I didn't exactly, you are a kinesiologist, right? You have a master's degree from Augusta State and also a bachelor from William and Mary College in Virginia. So what is, tell us plain people, what is a kinesiologist?
Kinesiology is the study of the body in motion. We look at all the biomechanical movements of the joints and muscle tissue, and we help decrease dysfunction in the body. A lot of people who study kinesiology go on to either physical therapy, occupational therapy, or they even go on to research. Some even go into the sports fields where they go on to be
Okay.
like strength and conditioning coaches and things of that nature.
But what you people are trying to do is give people information that can save lives, and while people are alive, they can live to the fullest with good health. And we can do these. Now, all right, stop smoking. That's way up there, right?
Sure it is. Stop smoking.
Eat fruits and vegetables.
More fiber, more fruits, vegetables,
And do some exercise.
and exercise. Yeah. But
Those are
it's not as
basic
simple
things.
as that.
It isn't.
It's simple. Those concepts are ideal, but it's not as simple as that, because the question then becomes, how much should you eat? You know, what are your goals? How much weight do you want to lose? How much exercise should you do? Is it safe? Because a lot of people like to do the exercises they did when they were younger.
Yeah,
They're
that's
training to play football and basketball. Well, now you want to do exercises that are going to be better for you to live longer. It's a different type of exercise. And Alice can tell you that it's not about running up stadium steps anymore and tearing your Achilles tendons or destroying your knee. It's about doing the minimum amount of exercise that will be effective to help your heart, at the same time keeping you safe. Because once you do so much exercise that now you injure yourself, all the work that you've done in exercise is for naught, and you're out for months at a time, and you lose the value of exercise. So that's where he comes in, and that's what he does. He prescribes exercise for you. It's a customized prescription that actually will help you individually based on you. Because Peggy, your body's not like my body, okay?
Everybody is.
And everybody's different. So you can't just prescribe one thing for everybody. You can't put everybody on a treadmill, you see. And somebody who's obese might require water therapy. So it's different for each person. To tell somebody to eat 600 calories who's 500 pounds or 400 pounds is not going to work. It's not going to make sense. So that's where Alice comes in. That's where his training is in ensuring that you're doing what makes sense for you to have good results.
Now, you have a practice in Greenville, South Carolina.
Yes, I do.
And we have a phone number. If anybody wants more information, we'll put that number up there on the screen. And for those people who are not here and could not avail themselves, what are some of the things that we need to be doing?
Sure. Well, the first thing that we need to do is to understand that we've often talked about risk factors. And the risk factors are, of course, high blood pressure, diabetes, high cholesterol levels, and smoking. Those are your major risk factors. Of course, obesity, and there are other things as well. But we need to understand that those are risk factors. And those risk factors are not, per se, items that create mortality, unless, of course, there are other problems taking place. And what I'm trying to say, to simplify it, is that the most important risk factor is high blood pressure.
That causes more damage to people and more heart attacks and death than anything else.
Anything else, because it destroys the heart. The pressure from high blood pressure increases the pressure within the heart, even at times when you're not feeling anything. So we have something called diastolic dysfunction, which only means that you have an increased amount of pressure within the heart. If you have that even as a young child, and by the way, the American Heart Association now recommends screening for heart disease starting at age 20. So even at a young age, if you were to exercise and you had an increased pressure in your heart, you would be at risk for sudden death. Okay, so really, high blood pressure is your main risk factors. We know this, that eating diets rich in saturated fats and meats, okay, where you get most of your saturated fats, is the cause of hypertension, diabetes, and high cholesterol levels, and in fact is the #1 reason why people develop diabetes. We used to think that it was a lot of sugar, but it's really the fats and the meats that we eat that's creating the
All right.
problem.
So if I'm hearing you right, you're advising people not to eat a lot of red meat.
Yes,
That's one thing. And
Yes.
not to smoke.
yes,
And to try to get exercise that is appropriate for where they are in their life.
exactly.
If you haven't exercised for years and you start with all this vigorous, you're asking for trouble. You start out and build.
Exactly.
So it's change that people can make themselves. Now, if people out there say, well, you know, I'm okay, I've got high blood pressure, but I've got medication for it and it's all controlled. Well, you can do something to maybe lessen the amount of medication you have to take.
Right. Peggy, what's interesting is this. There's a trial that was sponsored by the National Health Heart and Lung Institute, and it showed that if you aggressively treated your blood pressure with medication and you aggressively treated your cholesterol with medication, you didn't do any better. You didn't do any better. And the reason why is because you're treating a number.
Okay.
You're not treating the underlying problem, which is your heart failing. And that's what high blood pressure does to you. Until you correct that, you're not going to get any better. And your mortality rate is about 30% higher than somebody who's normal. If you're diabetic and your blood pressure is normal and you don't have a cholesterol issue and you don't have increased pressure in your heart, your mortality rate is the same as a normal person.
Okay.
Okay? But if you do have increased pressure within your heart, then your risk of dying is 30% higher than if you didn't. So you need to know that just treating your blood pressure with medication may not solve your problem.
And this sounds complicated, and to most of us it is complicated, but we can make a difference. And he has a book that we'll show. This is the cover of it. It's very interesting. We're going to go to a quick break, and when we come back, we're going to talk about healthcare, what is it? Healthcare heroes.
Right.
Okay. And then we have other material to show you, so stay with us.